Medical, surgical, cardiovascular systems. Now we're moving on to rheumatic or infectious endocarditis. So the basic etiology of this condition is usually secondary to poorly treated upper respiratory infections, usually caused by streptococcus. Infective endocarditis is usually caused by staphylococcus, streptococcus, or fungal infections in those who are immunocompromised. Endocarditis can sometimes be caused due to introduction of infection organism during surgery, dental procedures, and tattooing or piercings. So in other words, guys, the inside of the heart is inflamed. Some clinical manifestations include inflammation causes inside of the heart to become inflamed. Remember that the body's supply of blood travels through the endocardium. All your body is pumped by your heart. So all that blood and all of its components are passing through the endocardium. This will affect blood coagulation and may disrupt the clotting process. The patient will manifest flu-like symptoms, fever, heart murmurs, petechiae, the blood spots, usually indicating bleeding, splinter hemorrhages in the nail beds, Osler's nodes, painful tender lesions on hands and feet where your immune system attacks the tissue, and Janeway's lesions, painless hemorrhagic lesions on hands, usually palm surfaces and feet. Some diagnostics include throat cultures for strep, ESR, C-reactive protein, physical and medical history of the presence of an upper respiratory infection, usually a few weeks before the onset of endocarditis. Medical management primarily focuses on antibiotic therapy like penicillin or antifungals like amphotericin, and those are the main course of treatment. Patients may also be prescribed NSAIDs like ibuprofen as well. Steroids like prednisone are given used to decrease the inflammation. Dietary management includes low sodium diet, followed by a high protein and high calorie diet to help the patient's body heal adequately. Nursing measures include monitoring signs and symptoms of fluid retention, for it may indicate complications like heart failure that may develop secondary to endocarditis. Ensure to enhance clients to inform their dentist about endocarditis history prior to the dental work due to the high risk of developing reoccurrence. The doctor will probably prescribe prophylactic antibiotics for this.